Welcome again to the Medical Terminology Podcast. This episode is Chapter 11, Part 7, Ear Pathologies. Before we get to the pathologies, there are two specialties that we need to review. The first specialist is an audiologist, audiologist. An audiologist is a specialist in hearing function and rehabilitating those with hearing loss. Audiologists test your ears and then prescribe hearing aids that would best fit the type of hearing loss that you have. The second specialist we've seen before, and that's the otolaryngologist. otolaryngologist. And this again is the medical specialist in the ear, the nose, and the throat. Now for our pathologies, we can subdivide them by which part of the ear they affect. If you remember from our discussion of anatomy, the ear can be divided into three main sections: the outer ear, the middle ear, and the inner ear. So first we're going to talk about the middle ear. And the first is barotrauma, barotrauma. And this is discomfort caused by pressure changes, such as if you're flying in an airplane and you change altitude quickly and there's a pressure change, your ears can hurt, or if you're going up and down a road in the mountains. A way to remember this is baro relates to pressure, as in barometric pressure, and trauma, of course, is when you have some type of injury. So barotrauma, discomfort caused by pressure changes. The second term is a little tricky to spell, and that's eustachitis. eustachitis. This is the combination of eustacho and itis, and this refers to inflammation of the eustachian tube. From the word parts, the meaning is clear. It just gets a little tricky with the spelling, so you'll want to practice that one. Then we have three different types of a pathology known as otitis media. Now, otitis would literally mean what? Well, that would mean inflammation of the ear, and media refers to middle. So it's a middle ear inflammation. The first type is acute otitis media. acute, acute, and then otitis and media. And this is a form of middle ear inflammation that is associated with upper respiratory infections in young children. If they get a cold or a flu virus, something like that, it can cause this inflammation of the middle ear. The second type is serous otitis media, and the spelling here is a little funny. We tend to maybe want to call it serious. That's not it. It's serous, serous, otitis media. Now, serous refers to fluid. This is a fluid buildup in the middle ear that's following an infection or eustachian tube blockage. So this is like a step up from otitis media or acute otitis media. A child usually would have an upper respiratory infection, and it's possible that a fluid buildup could happen in the middle ear. And that would be serous otitis media. Then it can get one step worse, and that is the acute purulent otitis media. Acute, acute, purulent, purulent, and then otitis media. This would mean that there is a pus buildup in the middle ear. Purulent would refer to a pus. So there would have been a severe infection, and then pus builds up in the middle ear. Now the next term is myringitis, myringitis. And based on its word parts, what would you say myringitis means? Well, that would be inflammation of the eardrum. And remember, eardrum has two totally different word parts, which can be confusing. We have myringo, myring/o. And do you remember the other word part for the eardrum? I hope you remembered tympano, tympan/o, and tympano should be a little easier to remember because the medical term for the eardrum is what? That's the tympanic membrane. So the tympanic membrane is the eardrum. We have two word parts, tympano and myringo. And where they can be maddening is there's no real rhyme or reason to why we use one word part over the other. So you're going to need to pay careful attention and memorize these things. In this case, we're using myringo, myringitis, inflammation of the eardrum. Then we have a related term, infectious myringitis. Infectious, infectious, and myringitis, myringitis. This would be a contagious form of inflammation of the eardrum. It would be caused by some type of infection, and it could be passed from one person to another. Again, inflammation is very closely related to infection. If an infection is going on, there's going to be some inflammation. Inflammation, of course, can be caused by other things, but if an infection is going on, it's going to cause some type of inflammation, and that's why that suffix itis, meaning inflammation, is also closely associated in many cases with infection. Okay, well that covers the middle ear. Now we have the inner ear. And the first term relating to the inner ear is vertigo, vertigo. And vertigo is a sense of whirling, dizziness, and loss of balance. And it's important to remember that vertigo is actually a very severe situation. It's not just typical lightheadedness, or like one might feel when one gets up too fast, or if one's feeling a little faint. Vertigo implies you've got this feeling as if the whole room is moving, and you can actually have the visual change in which you look and you see the walls spinning around you. It's really like being on an amusement ride. And so that's a much more severe feeling than just a slight loss of balance. The next term is tinnitus, and it has kind of a tricky spelling. It's often misspelled. Tinnitus. It's real tempting to make that is, because we kind of say it tinnitus, as if there's an I. But there's no I there. We got to remember it's tinnitus. And tinnitus is a buzzing or roaring sound in one or both ears. The next term is labyrinthitis, labyrinthitis. And based on its word parts, what does labyrinthitis mean? Well, that would mean inflammation of the labyrinth or the inner ear. And when this inflammation of the inner ear happens, It can cause vertigo, that sense of whirling and spinning, and it can also cause intermittent or temporary deafness. And then we have Meniere's syndrome. Again, this is another tricky one to spell. It's named after someone. So it's capital M, E-N-I-E-R-E, apostrophe S. Meniere's and then syndrome. S-Y-N-D-R-O-M-E. And this is a rare chronic disease that produces vertigo, that sense of whirling, hearing loss, and tinnitus, which is that roaring or buzzing sound. Okay, and then finally we have a group of disorders that are related to hearing loss. There are different types of hearing loss. The first one is conductive hearing loss, C-O-N-D-U-C-T-I-V-E, and then hearing loss. Conductive hearing loss is a hearing loss that occurs when sound waves are prevented from passing from the air to the inner ear. And for example, if one has a big blockage of earwax in the auditory canal, the sound waves are not going to get past that blockage. And so the sound waves are not conducted. Another possibility would be, say, the auditory ossicles were seized up or broken. Something was wrong there. They would not be able to conduct sound waves to the inner ear. Now, the other type of hearing loss is sensorineural hearing loss. And again, that's a little funny to spell. Sensory, S-E-N-S-O-R-I, and then neural, N-E-U-R-A-L. Sensorineural hearing loss is caused by damage to the fine hairs inside the cochlea, or by damage to the auditory nerve, or damage to the brain. Unlike conductive hearing loss, where there's a blockage of the sound waves and they're just not able to be transmitted or carried, in sensorineural hearing loss, there's a problem with the conversion of the sound waves into electrical impulses. Either the conversion does not happen in the cochlea, or the electrical impulses don't get transmitted by the auditory nerve, or the brain somehow is not able to receive them or interpret them. So sensorineural hearing loss relates to problems with the electrical impulses. Conductive hearing loss relates to problems with the movement of the sound waves. Then we have two subtypes of sensorineural hearing loss. The first one is presbycusis, P-R-E-S-B-Y-C-U-S-I-S. And if you remember, presbyo means what? Well, it refers to age, and cusis refers to hearing. So this is a hearing loss that occurs with age, and it's a type of sensorineural hearing loss. It's a gradual loss of sensorineural hearing that occurs with age. Basically, over time, the fine hairs in the cochlea wear out or become damaged, and so they're not able to convert sound to electrical impulses quite as effectively. And then we have noise-induced hearing loss. Noise, N-O-I-S-E, hyphen, induced, I-N-D-U-C-E-D. And noise-induced hearing loss is a form of sensorineural hearing loss that's caused by loud noises. Okay, now that we've covered these pathologies, let's go ahead and do some practice. What is the term that refers to a sense of whirling, dizziness, and loss of balance? That's vertigo, V-E-R-T-I-G-O. And what is the term for a rare chronic disease that produces vertigo, hearing loss, and tinnitus. That's Meniere syndrome, MENIERE'(syndrome). And what does tinnitus mean? Well, tinnitus, TINNITUS, is a buzzing or roaring sound in one or both ears. And what is the term for an inflammation of the inner ear that causes vertigo and deafness? That's labyrinthitis, LABYRINTHITIS. And what is the term for inflammation of the eardrum? That's myringitis, MYRINGITIS. And what is the term for a form of middle ear inflammation in young children that's associated with upper respiratory infections? That's acute otitis media, ACUTE media, MEDIA. What is the term for a pus buildup in the middle ear that's caused by infection? Well, that's the acute purulent otitis media. And finally, what is the term for fluid buildup in the middle ear following an infection or an eustachian tube blockage? That's the serous otitis media, SEROUS, otitis, OTITIS, and media, MEDIA. What is the term for the gradual loss of hearing that occurs with age? That's presbycusis, PRESBYCUSIS. And what is the term for the type of hearing loss that occurs when sound waves are prevented from passing from the air to the inner ear? That's conductive hearing loss, CONDUCTIVE, conductive and hearing loss. What is the form of hearing loss that's caused by damage to the fine hairs inside the cochlea, damage to the auditory nerve, or damage to the brain? That's the sensorineural hearing loss, SENSORINEURAL, sensorineural, and then hearing loss. And what is the type of hearing loss that's caused by loud noises? Well, that's the noise-induced hearing loss, noise-induced, noise-induced, and then hearing loss. What is the term for discomfort in the ears that's caused by pressure changes? That's barotrauma, barotrauma. And what is the term for inflammation of the eustachian tube? That's eustachitis, eustachitis. And what is the term for a contagious inflammation of the eardrum? That's infectious myringitis, infectious, myringitis, myringitis. And what is the term for a specialist in hearing function and rehabilitating those with hearing loss? Well, that's the audiologist, audiologist. And finally, what is the term for a specialist in the ear, nose, and throat? Well, that's the otolaryngologist, otolaryngologist. And we could also use the term otorhinolaryngologist. Okay, that covers it for the trickier pathologies. Again, a lot of the trickiness is spelling, and in some cases, the fact that it may not be obvious what the word parts are. Next time, in our final episode for Chapter 11, we'll look at the procedures related to the ear. This ends this episode of the Medical Terminology Podcast.